Namaskar. We were doing our series on the farmers' bills and the state of affairs of the agriculture sector in India, but we will have to take a pause for a very good reason, and which is the phase two of COVID and the way it has, it has attacked us all over this country. I would like to share a small experience of COVID positive case in my family. I hope that that will help many of you also. I hope it can offer you some new angles to think of, some new insights, and the experience also results in a happy story of a patient getting better. And this happened in at this place. I'm at Sawantwadi, as many of you know. I'm doing my organic farming here, and my brother, who was visiting here from Pune, he started to get fever. He got it for 3 consecutive days, and also he lost appetite and was not eating well. And on testing, he turned out to be positive. And when he's, excuse me, later, he was hospitalized immediately. He seemed to be improving for some time, but after 3 or 4 days, suddenly his oxygen level went down, and he was in a serious state for 5 days. His HRCT scan showed 60% infection in the lungs with pneumonia. He was put on oxygen, and we were worried. We were very worried for some time. But after 10 days at the hospital, he revived enough for them to discharge him. It will take him a long time. They have said about 2 months or maybe more, to be described as physiologically normal. But he's home. And that's the best part. And I think he has beaten the worst of the disease. I would like to share a few observations from this experience, since it happened in front of my eyes here. Point number 1, how infectious is the new coronavirus? As I mentioned, my brother was here, but along with him also were my 2 sisters and their spouses. So we were in all about 6 adults, 5 of them 60 plus, and 1 me approaching that figure. And we also had a 27-year-old niece. So there were 7 of us living together for 3 or 4 days before my brother was known to be positive, and he was obviously carrying it, all the way from Pune, but didn't know it. So we all got tested, obviously, and we all came negative, and none of us had any symptoms either. And the moment my brother was hospitalized, he had to be taken care of. And it was my sister, me, and my niece, who the 3 of us spent 10 days in the hospital with him. My sister and I would do the day visits and spend 4 to 6 hours. And my niece, that lovely girl, she did what a seva she did to her uncle. She was there day and night by his bedside for 10 full days. On his discharge, of course, there was a repeat test done. And again, we have all come COVID negative, and the place where he was is a government hospital ward. They don't have private rooms. In the ward, there are 20 patients, all severely, all at various degrees of severity. Most of them on oxygen, and to be there in close proximity for 10 days. Section of a hospital reserved for COVID positive patients with 3 or 4 wards and ICUs, where every person who's coming in is in close contact with someone who's COVID positive. And in that environment, breathing that same air, and physically being very close, because my brother was for 5 days in semi-comatose condition, and he had to be helped up even to sit up in bed, to be taken to the toilet and back, etc., etc. I wonder if it's the infectiousness, when we say it's infectious, that you're bound to get the disease. That interpretation may be not so right. If a thing is infectious, you are bound to get exposed to it if you're nearby. That is true. But what happens in your body and how you respond to that exposure is, I think, where the word immunity and its importance comes in. Because I'm sure in that dense COVID positive environment, we also were exposed to some load of this virus. It has entered us, it has come in contact, but our system has not allowed it to dominate. So after point 1, infection, let's come to point 2, immunity. The physical immunity, of course, everyone knows intellectually that we have to have a good lifestyle, we have to eat nutritious food, we have to eat good food, organic food, hopefully, etc., etc. I mean, intellectually we know, and we are also aware at the back of our minds how much of those rules we break, and we have a fair idea of how physically strong we are, what is our level of energy and our level of stamina. I'm sure if we pay attention to ourselves, we will know how physically healthy we are. But the other aspect of immunity, which I'm going to in fact give it more importance here, is psychological, psychological factor, which also contributes to immunity. It's a very breezy day. I hope my audio is recorded properly. We have the cyclone, just off the shore of Arabian Sea here, and it's created a lot of storms around this place with heavy rainfall till yesterday. Anyway, a recent video I saw on YouTube was really heartrending. Here is a man, about 60 maybe, and he was lying on the floor. He had collapsed or something, and his daughter was rushing to give him some water, and her mother was pulling her back, saying, "Don't touch him, don't go there." It was heartrending. What are we doing to ourselves? I mean, the media has its role to play in scaremongering, but even the medical community, the way they have panicked, right from WHO downwards, I don't know if that level of panic is helping at all, and the wrong that it is doing is in front of our eyes. I have some people from the neighboring villages working with me for many years now. Then they aren't coming now because their village has suddenly seen a spike in corona cases, but they are in touch with me over the phone, and they tell me that out of the 35 to 40 cases that have arisen in just one village in the last 3 weeks, they've had 4 deaths too. But out of the 4, 2 deaths were of relatively younger people. One who was in his 40s and another in his about 50. And in both cases, they were in a complete state of paranoia and fear. In one case, and therefore they did not go report it to a doctor, they did not visit a doctor, they were scared of even mentioning, of thinking of the fact that they could be positive. In one case, when the doctor and nurse came with an ambulance, the man ran out to the fields and he returned, and they came the next day, and when he was taken, I mean, he had to be dragged and put in the ambulance, and he passed away in a couple of days. But what was the state of mind in which he went to hospital? The other case was very similar. In fact, it was worse in the sense that this man, his wife, was so scared that she left home 3 days prior to this incident, to his being found COVID positive, because he had severe symptoms and was afraid himself also, and she went to a neighbor's house apparently, and this man was cooking for himself, doing something, but adamant that I will not see a doctor. But they did come, the community health program, visits door to door. So they came, they took his sample, tested, and then when it was found positive, I mean, he had to be dragged like a child. He was holding on to the pillars of his house, and he was sobbing when he was put in the ambulance. He didn't last another 2 or 3 days. And in both these cases, the patients went alone to the hospital. There was no one accompanying them. What is the level of fear that we have brought upon ourselves? Just think about this. And also, what this does is to disrupt our very spontaneous show of affection, of brotherhood, for our neighbors. This is something that we must really ponder over. What has contributed to this is not just the scaremongering in the media, but also the attitude of sorry to say, the medical community. Here in this town, I would like to share with you how our private doctors were the first to shut shop when the corona phase 1 started. Even during phase 2, when my brother was in his third day of fever, I took him first to a GP. And guess what? The GP had put a notice on his board, if you have fever, then don't step in here. You can go to the government hospital. So this is the state of affairs, and no wonder then that such a deep state of paranoia has spread in society. So we have covered 2 points: how infectious is the coronavirus, and 2, how fear plays a very important role in our immunity. The third point is about the district hospital where my brother was for 10 days, and what is the state of affairs there and the kind of treatment that he received. For most of you watching this video, considering many of you are known to me and known to people who are known to me, I'm speaking in the English language, I would assume we are all urban elites watching this, and for most of us, going to a government hospital would be the last thing on our minds, wouldn't it? I doubt if any of us would voluntarily, willingly go to a public hospital. And it is therefore even more important, this third point that I want to make. In our case, we never had a choice. My brother is a resident of Pune, but he happened to be here in Sindhudurg, a rural district, sparsely populated, and which doesn't have many private hospitals who were taking COVID cases in any case. So we had no choice, and which is a good thing in hindsight. We went directly to the district hospital, and I must share with you the excellent work that the doctors, the nurses, and all the attendant staff there are doing. My first observation is that the ward in which my brother was in, he was sharing a bed with 19 others. I think it was a 20-bed ward. The first thing is that there was enough sunlight and fresh air. I think that is such an important thing in healing. I do feel that has its very strong contributory role, rather than being cooped up in an air-conditioned room, which was what would have happened if he was in a Pune, 5-star hospital. There was a fan above every bed, but also the entire walls on both the sides were lined with windows, no curtains. It was open, and often there was a nice fresh breeze blowing in as well. So even though it was summer, it was getting a little hot at times, but the combination of sunlight, abundant sunlight, and fresh air, I cannot value it less. It is so important in this case. Another thing about the district hospital was that they allowed us to have an attendant present for the patient, and also allowed us to bring home food. So in that sense, I think it helped my brother. We gave him haldi doodh and khichdi and so some churans and pech, we call it here locally, or kanji in the south. It is it's parboiled rice cooked boiled with a lot of water, and you give him that, you can call it soup maybe in English, rice soup. That's very good for health, and we did all such things. Now this is a departure from what had happened last year during COVID phase 1. I recall this horrific video, a series of them actually, from major metropolitan cities, of people, wailing outside hospital gates, saying that their mother or their father or their husbands or wives were inside, and since they were not allowed, they were barricaded right at the outer gate, and they were just weeping and wailing and wanting to know, how is my father or mother or husband or wife, and which ward are they in, how are they doing, what is their condition, and they were getting no answers because the hospitals themselves were putting in process some mechanism which they were not familiar with, and they could not address this sudden crisis last year. I don't know how they do it now in the private hospitals or in the government hospitals in Bombay, Delhi and Pune, etc. But fortunately in Sindhudurg district, we are sparsely populated. Maybe for that reason, or they have learned their lesson. They welcomed family members to visit, and also for one attendant to be there with the patient 24 hours a day. And what a value this adds to healing, the process of healing. For a patient to have someone nearby, so, some person from the family, a family or a friend nearby, is tremendous help in healing the patient. And the needs of the patient really vary. Let me tell you, there were some relatively younger people in neighboring beds, and they seemed to be having a hearty meal and speaking, and they were low on oxygen, but they were on their mobiles, they were active. But there are other types, like my brother, who needed complete assistance. So and in either case, whether you physically need assistance or not, for the patient to know someone is there next to him, right next to the bedside, I mean, it doesn't take some very complicated PhD to arrive at the conclusion that this really does help the patient. And as I've said in point 1 on infection, it is not such a big threat to the attendants as people may make it out to be. Now, there were two factors about this public hospital, which I would like to point out, but not as a criticism of this hospital, but as a pointer towards where systemically modern medicine is taking us. And the first point is again, food and health. The relationship which we spoke about is so important. Somehow in modern medicine, they've created a huge distance, so much so that even doctors don't talk about it. They don't ask what is the food that you've eaten or are eating, and they don't advise you on what foods to avoid and what to take. Food is never a part of a question that a doctor asks you. And so in this ward, I'm saying some other patients, they are in a critical or a serious condition, and their attendants are bringing various things from, including cold drinks, colas, and many things which even common sense tells us one should avoid, but that connection which is broken, that's affecting all of us too, if you see. I mean, digestion problems and constipation is such a common issue now among so many of my friends and contemporaries, and I see that while they're intellectually aware of the problem, they still eat maida ka sandwiches, and which is not going to help at all. The other problem is about the approach of the doctors themselves. While they're studying, for their degrees, and while in the earlier stages of their career, possibly they're more interested in the clinical status, in the clinical activity of a doctor actually seeing a patient. But what the system has done, right from the WHO downwards, is they have made doctors into soldiers. Soldiers don't decide anything. Soldiers don't even know who is there in front of him. He is given a gun, he's told which direction to point, he's given a particular bullet and said, fire this. Doctors have unfortunately become like that. The human element, a soldier is a dehumanized human being. Similarly, doctors are, we are removing the human from the doctor, and they just given like a machine, a program, their program. If it is this, if the machine, this reading is this, then give this medicine. If the reading is this, give this medicine. Something to that effect. I'm sure at an individual level, doctors would like to, to look at each patient even more closely. But whether a system allows him and encourages him to do that and to actually experiment with his own approach and line of treatment, I doubt if that is happening. So even in the ward of 20 patients, even though all of them are COVID positive in various stages of severity, I could notice distinctions in the way the illness, the disease was exhibiting itself. So not all patients were alike in the way they exhibited their symptoms. They were not alike in the way the illness was affecting them. And yet, unfortunately, the system is such that it's a rigorous follow the protocol, follow the process system, where the doctor has to refer to a manual. It's like a machine. And at this stage, you give steroids. At this time, you give blood thinner. If this happens, you then give an antibiotic. After that, you give the Fabiflu. After that, you give remdesivir. This seems to be a standard protocol, and nothing wrong about a standard guidance coming from above. But somehow, somewhere in the system, have we devalued the role of the human being in the doctor, of the sensitive, intelligent person in the doctor who can make his observations at a local level, at a specific level, and also have a choice of modifying the line of treatment. I doubt if that can be allowed to happen in today's modern medicine. A point about the time given by the doctor to the patient. I do wish the doctors would give some minutes per day to each patient. I know there is a lot of stress. There are many patients in the hospital, but it is certainly not impossible for the doctor to give 2 or 3 minutes per day to each patient, to talk to him, to listen to his problem, and to tell him what is his state of health right now, to tell him a little bit about what is being done to him, and so that the patient can also feel that, okay, yes, the doctor has shown me the way. This is what is going to happen over the next few days. I think that will certainly help in hastening the healing process. It is just 3 minutes for the doctor, for a busy doctor, yes, but those 3 minutes can mean a lot for the state of mind of the patient, who feels that yes, he has understood, he has listened to the doctor, he has understood, and he knows somewhat what is going to happen to him. Last year, during the first phase of COVID, India recorded cases at a far lower rate, and there were far fewer serious cases, far fewer, but there was a much lower death rate, etc., compared to many countries in Europe and America. And many friends asked me what I thought was the reason for this. I felt there were 3 or 4 good solid reasons according to me. One was, I think that the fact that we hardly any of us uses the flu vaccine, and most of us are exposed to the regular cold and cough and the local flu every year. I think that the repeated exposure and repeated building up of a resistance to it can be a reason also why our immunity against why our resistance to this particular virus has been higher. Second reason, I think, is that we have local food. We home cook food in India. 99.9% of homes in India cook food every day, twice a day. So we have this cultural lifestyle of home cooked food, hot food, nutritious food, having it every day, and no central processed food which is part of our main diet. I know that in the cities, the next generation is especially those cut off and living alone, are dependent more and more on these processed food now, but those are still a minority as of now. The majority of India still cooks food, fresh food every day, and I think that is the reason. The third reason is that the Indian cuisine culture, which has evolved over thousands of years, has very beautifully decentralized very good practices and made them reach every home. Every Indian kitchen is filled with useful spices and very useful herbal ingredients, which are part of the food preparation itself, and whose qualities also most people or some people in every family are aware of. So I think this is another very good part, according to me, when you have these herbal components and useful components from as part of your food preparation every day, that also must be contributing somewhere or the other to keeping you in good health. The third reason of also I felt is, which a lot of people don't immediately catch, is all the news comes from the metropolitan cities. All the news worldwide, it's dominated by the urban elite, by the city elite. So the moment you say India, actually you're not referring to India. You're referring to Mumbai and Delhi and Bangalore and Chennai and Kolkata. I mean, these are the places that the people abroad see as India. But we should not make that mistake. So the fact that 70% of India is not living in cities is a very, very important factor which also contributed at that time to us having lesser cases of COVID, lesser spread, because rural India is far different. One, in geographical spread and population density, of course, but also in terms of having much more natural resources in terms of fresh water bodies, rivers, lakes, ponds, hills. Well, this place is one example you can see behind me. But of course, I chose this place because I wanted such a place. But people who live here, they have just inherited it, and they have the beauty of nature and nature's nurturing qualities. They're living amidst that. It's a totally different story with COVID phase 2. Once it's over, we can maybe sit down and analyze, because from the reports that we are seeing now, the death rate has risen from 1.6 to about 2.4. That's what our district hospital CMO told us yesterday, and also many younger people are dying. So this is something we'll have to readdress after phase 2 is over. This is the experience of a COVID positive patient in my family, and what we saw him go through, how we saw the treatment given to him, and also the happy ending that he did get better. He got ample support from the hospital and the doctors, and somewhere, since there is such a wide spread of COVID, if this experience can help some of you, God forbid, you should not have a COVID, encounter case in your family. But if you do in your family or your friends, this experience may provide some useful things to think about, some pointers, and also this experience comes with our best wishes, so that everyone can get healed faster and get healthy as soon as possible. I do know that my brother was a little lucky in that he got good treatment, good facilities, and with no shortage of anything. And I'm reading in the media and watching in the media horrific stories of the lack of oxygen, the lack of medicines, the lack of hospital beds, etc. That is the subject of another video. But what can we do? We elect our leaders in good faith, and if they turn out to be incompetent, stupid, megalomaniacal, only bothered about publicity and not about doing actual work, what can we do? We just have to tell them that they are not needed anymore. Hi, I'm doing this small clip. I'm adding this to this video I recorded earlier because I was sent a fantastic video presentation by a friend of mine, K.Ramaswamy. Thank you very much. And which was in my Gmail inbox for 2 days, but because of the storm and I'm on an off-grid farm, I was really using my solar very carefully and did not open my laptop. I just saw it and it is outstanding. It's an interview with Dr. Shankara Chetty, a person of Indian origin in South Africa, and his experience of dealing with 3,000 to 4,000 COVID patients and his insights are truly worth watching. I will put a link in the description. That will be the first thing you will see in the description. Please do have a look. I made an amateur, personal experience video. This is the real stuff. Watch it. He's got some tremendous insights. Thank you. Namaskar.